The day when either Cover Oregon or the community partners shows up at your place, and people will be signing up, the youngsters will be signing up individually. I think that was
Mary, our information.
Our understanding in the Senate. But we'll just walk you all through it until we get those youngsters involved.
Thank you so much.
Yes, sir.
Hello, my name is Harvey, also known as Mr. Alameda. I have friends who are older, who don't have dental, they need dentures, they need dental care besides medical. So is this going to cover dental too, or just medical?
It's going to cover mental health, physical health, dental, and vision.
For a low-income team.
What's the range?
Amy, why don't you go through the eligibility, and then we'll talk about it in a second.
So for low-income folks, seniors or others who qualify for the Oregon Health Plan, that will cover the dental and vision. Through Cover Oregon, if you're a little bit higher income and don't qualify for that, we'll be selling dental policies as well that people can select from.
But a low-income senior, for example, could get help with those kinds of services.
What's the scale?
Amy, do you want to give a ballpark for the amount? Because I want to talk about the future a little bit too.
Sure. So the income level is the same whether somebody, as long as they're under 65, they can get services, and the income sort of guidelines are the same. So up to 138% of the poverty, which for an individual, I believe, is around $22,000 a year. Folks will be able to get onto the Medicaid or Oregon Health Plan. And then beyond that, up to the 400% of poverty, then folks will be able to access tax credit to help them pay for the cost of that insurance.
The other point with respect to your very good question, sir, is that Medicare never covered dental. And a lot of us have always thought that was a major gap and a major problem. What we're learning now is those diseases of the mouth and the absence of dental services really is a predictor of much more serious kinds of problems. And I want you to know that while these services really start with the low income, with the Medicaid, we're glad we have Cover Oregon to start helping a bit with the people who are just above those income criteria. I want you to know this is going to be a priority of mine in the days ahead on finance. When I talk to people in the hospital who run the hospital emergency rooms, we're seeing an increasing number of people come to the hospital emergency rooms because they get these problems, they get a serious infection, they can't afford the services. Eventually they go to the hospital emergency room. The staff there are very capable and compassionate. They help the person stabilize and maybe give them some meds, but then they're back into the community and the whole thing happens all over again. So my sense is we're going to see a lot of changes. Back east, there are already some hospitals talking about putting dentists in the emergency room because this is that serious a problem. I want you to know that not only are there some services available now, but this is an area that's going to get a lot of attention in the Congress in the days